Workshop Wednesday Rewind with Dr.
Really
KiKi.
good. I thank you so much for taking your time out to sit down and talk to us on today.
No problem.
Oh gosh, I see you had your face mask on.
Yeah, I'm in the ICU now.
Oh, really? So what's your day like?
I get in and then I leave when I'm done when the work's
You have a lot of cases. I mean, it's just really unpredictable, right?
yeah, we've got about 6 cases that are on the vent here in the ICU. And then we have several cases that are under investigation, some that are positive that are just on high flow supportive oxygen, and then a few on regular that aren't on oxygen at all.
Okay. And I've been looking at the news, and because they said that they have volunteers that are taking the vaccine and things like that. Are they getting the volunteers from the patients that are in the ICU, or how are they doing that?
No, if they're acutely ill. If they're sick, vaccines really aren't indicated for acutely ill individuals because your immune system's already kind of geared up for fighting a disease. It doesn't have the stamina to try and generate an immune response. Vaccines are used to generate an immune response several weeks down the road. Somewhere about 3 to 4 weeks after you get the vaccination is when the immunization starts to kick in and the body starts to produce the antibodies that you are trying to elicit with the vaccine.
Okay. So it wouldn't be anyone that was already being treated.
Nope.
Well, okay.
Nope.
Okay. I know, like I said, I know you are very busy, so I sent you a few questions.
Okay.
All right. One question I sent you was, how does the coronavirus impact individuals with asthma and sleep apnea? Because I know that's kind of like your specialty area,
Mm-hmm.
as compared to others who wouldn't have such a pulmonary disorder. And what precautions should an individual with asthma or sleep apnea take as they prepare to re-enter the workforce? And I'm asking because, I have a father that has sleep apnea, and he has a CPAP machine and things of that nature. And I have an uncle that also has it and is being hospitalized due to the coronavirus. And, sometimes they take the treatments and then they wean themselves off because they think they don't need it as much. So, like, how does that look as we re-enter the workforce?
So as we re-enter the workforce, the biggest things for that group of patients, but not just them, but pretty much anyone, is appropriate precautions, things that your parents taught you when you were a kid. Wash your hands, appropriate hygiene, your elbow, but not just out for everyone around you to catch your cooties. Doing the appropriate things that you should to help prevent the transmission of any type of bacteria or virus to those that are around you. What's really big, particularly at this current junction, is the use of the face mask, because the face masks do form a function in helping to provide a barrier to infection. If you think about how that works, the virus is transmitted through respiratory droplets. So you breathe, there's a lot of moisture. When you breathe out, some of those viral particles can be in little drops of air that come out when you're breathing out. The mask helps to capture those droplets and try to prevent the spread of a large volume of those respiratory droplets. I'm sure that many people have seen there's a article about anything you can find on the internet these days where they talked about how masks are useless, and they tried to document how they sprayed into a mask and you saw stuff that passed through the mask as a reason to justify how it's not effective. And the reality is the use of the mask is a barrier. It minimizes impact or the volume of spread that you're going to produce. If they wanted to really illustrate that the way that they should have sprayed without a mask in front of it and then sprayed with a mask in front of it and see the difference in the production. The other difference is when you're using a spray can, you're spraying with a volume and speed that's different than when you would cough. And you're also dealing with a different mechanism. So the spray bottles are going to eject at the tip of the bottle out. When you're coughing, you're generating that cough here in the throat, and then the speed comes up and out. So by the time it reaches the mouth for dispersal, it's at a slower speed than when it was coming up through the vocal cords. So it's not apples and apples comparison when you're looking at that demonstration versus what's happening in real life. And the big thing that you're trying to prevent when you're looking at using the mask is to minimize the amount that you're producing, and you're also minimizing the amount that you're inhaling from the environment that's around you. So that's the importance of using the mask.
You have so many things to get back to, and we thank you so much for taking the time out to talk to us.
You're welcome.
Thank you so much, Dr. Lott.
You have a pleasure.
You too. Thank you so much. Bye-bye.